Okay, so we're going to get started with our cup of tea here today. On the agenda, I have a little bit of housekeeping I'm going to cover first, a couple of announcements. I'll share some information about cup of tea, and then we'll go into the article summary, and then we will have our conversation with our group here. So what's happening today, we're trying something a little bit different. We've had a comment or a suggestion to have the Gather Town experience, which we've had in our symposium in January, part of our cup of tea meetings, so that there's this virtual area where people can hang out and chat. So it's a little bit different than Zoom, and people really enjoyed it during the symposium. So we're trying this today through our Zoom meeting here. This is where the presentation is happening, and we'll recording so we could save it to YouTube and create a podcast out of it. This is also a setting where more people are used to and we've experienced before. So for the best layout, you can use speaker view. We can use a raise hand function, or you can type in the chat if you have any questions or comments. We can save all those questions and comments kind of near the end. We'll have some time for those. So Gather Town is more of a lounge atmosphere. So there's a game-like setting where you're moving an avatar with arrows. And we have our lab member there who's sharing her screen to the room. Hopefully you guys are watching and hearing all this. And you'll be able to see our presentation. You'll be able to ask questions within Gather Town, and then Farheen will relay them to us here in Zoom, and we'll be able to answer them. So you won't be able to chat with us, but if you have a story and wanted to sort of be part of the conversation, the link for Zoom will be shared in Gather Town and vice versa, so that people can switch. But I would just like to advise, if you're careful with the switching, and mute yourself and close the video just so there's no background noise when you're doing that. And it's our first time trying this, so bear with us. Okay, so for my announcements that I have, I just wanted to share with everyone again about our Retinoblastoma research community. The Retinoblastoma research community was formerly known as the Retinoblastoma Research Registry. This was created to connect people who are personally or professionally connected to retinoblastoma and have an interest in research. We welcome international sign-up for all retinoblastoma patients, including family and friends, researchers, and health professionals. So you can visit our website, you could learn more, or you can go directly to this, you can go directly to the RV research community to sign up. And the benefit of signing up is events like this, the cup of tea, and our symposium, and any of these other amazing meetings and events that we host, and project opportunities are shared through people who've joined the research community. So that's the best way to make sure you stay in touch. And you can also share that with your family and friends too, to make sure that they are aware of what's going on as well. So we also have some opportunities for people to get involved. First opportunity is we're looking for a patient in research to join the team with a flexible paid part-time role. And more information can be found about this opportunity by emailing us at retinoblastoma.research@sickkids.ca. And then we also have a working group where, out of our top 10 retinoblastoma research priorities that were established, one of the priorities is seeking to address the psychosocial needs of retinoblastoma survivors and families. The study has been launched this August, and we are looking for some you guys to participate by either filling out a Google form to receive recruitment materials, which you can then share with either families that you take care of as a clinician, or families that you know. Even if you are a family and know other families, you could share this information with them. If you are eligible, so this is for survivors over 16 and parents and caregivers, fill out the questionnaires, please. We also have a working group that is working on this study, and we welcome everyone to participate. I can also share more information with you about that by emailing us, and then we can connect offline. Okay, so the Cup of Tea is like a journal club, is an event intended to bring the Canadian Retinoblastoma community together for an informal discussion about a research article. Discussions center around an article which our member from CRAB has created a plain language summary for. They create the summary together with a non-patient partner. And past Cup of Tea recordings are available on our YouTube channel if you search Retinoblastoma research in YouTube. Now, we've had some success of running this Cup of Tea over the past 2 years almost, where we're also now working on creating a podcast of the audio recordings, which was suggested at a past RBA Research Symposium. And if you're interested in helping with this, there's a lot to be done. We welcome more people to participate and join to help us achieve this. So how does this plain language summary work? We, a patient partner who is interested in participating, so a patient being not just a patient, or it could be a survivor or a family member. They select an article of interest, and they receive guidance from myself on how to read the article and how to write a plain language summary. And they get partnered with a clinician or researcher who may or may not have been an author on the article. And then they work together, guided with me, to write a plain language summary, which is then presented at this Cup of Tea. So that's like the short version of what happens, but as everyone who's done this before can tell you, there's a lot of back and forth. There's several meetings sometimes we do to review the article, review how to put a cup of tea together, answer questions, and it's all done as a team. And at the end of the day, I'm very proud how it all works out. Okay, so our today's cup of tea, we're going to be discussing a review of literature on health-related quality of life of retinoblastoma survivors. The plain language summary is available on our website. And our speakers today are Michelle, who is a retinoblastoma survivor and a recent University of Toronto graduate. Michelle is also a longtime member of the Canadian Retinoblastoma Research Advisory Board and participates in many working group meetings, events, and research projects. And the partner she has been working with is Alyssa Ulster, who's a social worker who works with retinoblastoma families at Sick Kids. Alyssa is also an active member of CRAB and participates in working groups to move research forward. So I'm going to pass it off to you, Michelle. I'm going to stop sharing so you can share your screen.
Perfect. Thank you so much. Get this started. All right. Is everyone able to see that? Okay. Great. So you heard the title of the paper, so I'll just get into a little bit about my story and how that ties in. So I was born and raised in Albany, New York, which is like 3 hours north of New York City. Shortly after birth, I was diagnosed with bilateral retinoblastoma. It's something that ran in my family. My mom had it. One of my brothers had it. One of my brothers was unaffected. So it took about 3 years to treat at Sloan Kettering in New York City. And it took a lot of different treatment methods, basically whatever was available at the time, short of enucleation. And I finished treatment at age 3 in 2003. So there's 2 photos on this slide. On the left, there's a picture of me at around 5 or 6, I think. There's a Memorial Day parade going on in the background, and I'm like making a goofy, surprised face looking at the American flag I'm holding. And then on the right side, there's a photo of me with my mom. I think I was around 4 here based on, I was in my old house before we moved. And she's standing directly behind me, but I was quite tall for my age, so I'm like a little bit taller than her waist. And we're both wearing like matching white t-shirts. Next. So over time, as different stages of my life, and we'll go into a little bit of different parts of my survivorship, started to develop interest in both art and science. As you may have heard, pursued more of the sciences professionally and academically, because since I finished my degree at U of T in, it's a mouthful, health and disease and ecology and evolutionary bio. So a lot of bio, but I was able to pursue kind of an academic interest in retinoblastoma and in general with like other conditions, how people kind of end up in the long run and how like or the early experiences can shape their experiences later on. And then on the side to this day, I sing and dance and draw, and that's taken, a different role in my life over time, but I think it's helped in coping and grieving at different points of my life as well. So growing up, I think RV has shaped my life in a few ways, especially when I was younger, and my peers kind of didn't know how to kind of understand and verbalize like differences, especially with my appearance. I did kind of deal with bullying and stuff when I was younger. Um, and for a while being able like to understand and kind of navigate how to disclose that I was an RBA survivor and that I was visually impaired, could be, that was something that I had to kind of deal with socially at the time. Over time, there's been other physical, like late effects that been handling, some eye-related symptoms, which have come to the forefront a little more now that we're on the computer more often than before, as well as some like second cancer concerns, a major misdiagnosis of a second cancer at one point. And then unfortunately in 2017, my mom passed away from a third cancer. So these are things that have kind of been, you know, a topic of discussion over the years. And like, fortunately, having family members with lived experience as well has opened up opportunities to share and compare these experiences and how, even though we kind of shared the same diagnosis, we all like ended up having different kind of life experiences as a result and how RV has kind of shaped us in different ways. So, because of these, I've been interested in how RV can impact people into adulthood, both physically and mentally, especially because it's something that, many people are too young to kind of remember their actual treatment diagnosis period, but it's still something that like is a part of you even as you grow up. And just in general, I was interested in this paper because it's kind of a broad scale and is kind of analyzing pre-existing research articles. And that's like generally the type of topic that I am drawn to, kind of the larger picture. So yeah, we'll be looking a little bit into how, as time goes on, RV impacts people's quality of life. But for that, I guess a little bit of where I am today. On the left, there's a photo of me at my uni graduation. I graduated in June, and I'm standing in front of a brick wall with the University of Toronto like insignia that says "Congratulations to all our graduates." I'm in my robes, holding a bouquet of flowers and my diploma. Now, excited to start with my career. It's a little surreal still. And I've stayed in touch with choir, which has kind of been the main artistic outlet through, you know, dealing with a lot of um, experiences when I was younger, and especially like when I lost my mom, being able to find comfort in music has been really big for me. So on the right-hand side, there's a photo of my current choir, and there's about 40 or 50 of us in the photo all wearing concert black. I don't think you can really see like my actual face in the photo. I think my forehead is visible, but yeah, we're all wearing concert black and we have like our folders with music in it. And the Hart House building at U of T, which is this like old 100-year-old building. So it's been a lot of fun. So that's a little bit about my story. But I guess getting into the article, just a review on what it's called. It's called a review of literature on health-related quality of life of retinoblastoma survivors. So a bit of a mouthful. So I guess to start off, what is health-related quality of life? So when you break it down, it ends up being a holistic picture of someone's mental and physical health and how that gets measured. For instance, when someone is doing research, can be done in a number of different ways, and we'll get into a little bit of how some different researchers have approached this question. But what the article aimed to do was analyze already published research articles. So they went on online databases and entered like search terms similar to Google to find research publications that were related to specific topics. So they picked health-related quality of life, outcomes, which is the term usually used for like how someone turns out after their diagnosis, and retinoblastoma. So this search resulted in 15 studies that they looked at for this review. It encompassed both child and adult survivors and from 8 different countries. I believe there's a map. Yep. So on this slide is a world map, and there is a red star for each country that one of the articles came from. So there's the US, the UK, the Netherlands had multiple articles, Italy, Switzerland, Israel, India, and China. So looking at and compiling the results from these research studies, they were able to narrow down things that could be predictors of health-related quality of life. And some of these were the age of RV diagnosis, visual acuity, which is like how someone performs on an eye chart, like overall like vision, and whether someone's experienced bullying. Things that were not significant predictors of health-related quality of life were things like gender, whether someone had unilateral RV versus bilateral RV, and we'll get into that in a second. The type of treatment that was used did not predict the quality of life, and whether the tumors were contained in the eye. So interesting kind of snapshot here. So when it comes to unilateral versus bilateral, bilateral survivors did have unique concerns when it comes to quality of life. Bilateral people, due to the heritability factor, have like specific anxieties around having children or potentially getting cancer again later in life, which is a concern that many unilateral survivors like don't have to deal with. And unilateral survivors were more likely to have positive outcomes, like satisfaction with how their face looks. But when you kind of encompass these things, while they're like these anxieties and these feelings were reported, overall, when you look at the psychological and social outcomes and how they're like doing psychosocially, there's no significant difference between how the bilateral survivors are doing versus how the unilateral survivors are doing. Another thing that was interesting is that 4 studies had both the self-reports of child survivors, as well as the parents reporting their observations of the child. And when both of these were included and you compared the two, the parents reported consistently worse quality of life for their child than the child reported about themselves. And this was something that I personally found surprising, I guess, at first. And then, once I, processed it for a moment, it made kind of sense because, parents have to often see um, a, a lot of the difficulties of, the treatment process that the child may not remember as well. Um, and we can kind of discuss this a little bit later, but yeah. So I guess tying back to the map that we had seen, when it comes to geography, all of the studies were conducted outside of Canada. The countries around the world have different healthcare systems, and for instance, America with a largely privatized health system, that will impact a lot of things about people's health and their RV journey. Um, the wait times between the onset of symptoms and an actual RV diagnosis can vary pretty widely from country to country. Um, and there's also, concerns like access to care, cost of healthcare, things like that. So, it is something that contributes to the conversation when you're determining how these studies may like reflect the country that they were done in and how they may be applied here. And it's something to kind of think critically about. So in general, health-related quality of life is a pretty broad topic. Um, Different studies use different ways of measuring health-related quality of life. Different surveys may ask different things. Different performances may be used to assess something like psychological functioning. So there's no true current gold standard way of measuring it right now, and that's something that people are interested in conducting with further research to see um, for RV survivors especially, but like childhood cancer survivors in general, what would kind of be the most effective way to get this snapshot of someone's health-related quality of life. Um, and I guess the other note was with when using siblings as control groups. So oftentimes in these studies, they compare the survivor to an unaffected sibling. And the reason why this is usually done is as a mean of comparison to someone who is similar in many aspects because they were raised in the same family. They're oftentimes genetically related, things like that. Um, to see how much of a difference the RV itself is making. Um, However, that does present a difference between the sibling and the general population, since siblings often undergo their own kind of journey when one of their immediate family has either gone through cancer diagnosis and treatment, or um, or having a sibling who's visually impaired, something like that. So it's important to hear kind of patient output in these situations, because this is something that, may contribute to a study of how, you know, there may be a difference between the sibling and the general population. And these are things that, you know, can be brought up when patients are involved in kind of the process of planning these studies. So, as I mentioned before, part of the um, kind of results and discussion of this review was that more research should be done to better understand how to assess and um, just how to learn more about the quality of life of retinoblastoma survivors. And there's an ongoing study now, and there was in 2017 a list of the top 10 retinoblastoma research priorities, and this was compiled by patients, families, health professionals, and researchers. And priority number 3 out of the 10 deals with psychosocial support for RB survivors. And it states how to provide culturally competent social, emotional, and psychological support to retinoblastoma survivors, patients, parents, and families at diagnosis and beyond. And Dr. Damaris is partnering with researchers, clinicians, and retinoblastoma patients and families to develop a study to uncover unmet psychosocial needs for Canadian retinoblastoma patients and families. So this is super exciting because this would mark one of these sorts of studies being done in Canada, um, as well as kind of addressing a need in the community for understanding what needs are like not being addressed or not being addressed like appropriately for psychological and social needs. So it's always exciting to hear, when more research, like when more it the suggestion is more research to be conducted, it's very exciting to see it happen so quickly. So does anyone have any questions, I guess, before we get into the Q&A about um, the paper or what it was trying to aim to accomplish? I don't think I can see the chat.
Oh, I can monitor that for you.
Okay.
Maybe while people are thinking, I wanted to ask you, Michelle, first, thanks for the really great presentation.
Yeah, thank you.
But do you feel that the questions that you had in the beginning, wanting to, were they answered by this article, or do you still feel like you have questions or more questions than before?
Um, I think it like answered a lot of questions that I didn't present initially at first. Um, the paper was very dense. I tried my best to consolidate it for like the purposes of the presentation. Um, but I was especially interested in like how a lot of the intersections were brought up, where, they're kind of broke it down to the nitty-gritty in terms of how for very specific things, like unilateral versus bilateral may be different, or for um, different degrees of visual impairment, things like that. So, geez, can't think of something off the top of my head but now, but I can definitely say that like it brought up interesting things that I didn't consider at first. Like I think I mentioned with the parents. Guess are there anything? Otherwise, I have a question for Melissa. Sorry to keep you waiting in the wings for a bit.
That's completely fine. Sorry, I've had to move to my phone because my laptop froze. So
No worries. Um, yeah, so I guess when thinking about kind of as you've been looking through the paper with me and everything to prepare for this, it's a very like diverse set of needs that may be for like that survivors need or their families. So I guess if time or money or anything was not a concern, how would you like to see these needs be met in your experience?
so I think certainly in my role, what I would see is what I do see is the value of potentially a virtual group or groups for survivors, and whether that be again for children and families, adult survivors. I think the opportunities to interact in person are fantastic, and I know that they're very meaningful for patients and their families, and older survivors. However, there's also the geographical kind of piece as well that it can be difficult for many families to be able to participate. So I think what we've kind of learned also through COVID is that we can also, virtual opportunities sometimes work quite well. But yeah, I do think that more opportunities for patients to, engage with one another, for survivors to engage with one another. Those are my initial thoughts anyway.
Yeah, that's interesting.
Alyssa, I was wondering, there was the point raised about siblings being used as a control group. And would you have any comments about how, if you've noticed siblings while taking care of the retinoblastoma patients, do they experience a different kind of journey, or would you say in your experience they are very similar to the general public?
I think siblings, particularly siblings are certainly experience their own journey. You know, depending on how old the child is, you know, they're witnessing their parents, you know, often away from the home, caring for their sibling. I think there's many feelings associated with that, and also depending on a child's age and developmental stage and understanding of kind of the circumstances. So I think they're, you know, siblings is a very unique population, and again, I think very much going through their own process, even if they are not able to fully vocalize it.
Mhm. Yeah, that reminds me, my oldest brother is 13 years older than me. So since my treatment lasted like a little over 3 years, that was much of his high school years was having, you know, his sibling go through treatment and, you know, grappling with both that and seeing it from the perspective of like being a survivor himself. I can definitely see how that would be, you know, a major thing to go through for sure.
Does anyone else have would like to share about their lived experience or experiences of their patients that they've heard about some of the topics that we've covered from this article? Or any aspects that were surprising? Also, any comments about what kind of supports would you have liked to have seen, or what supports did you have that you really found useful and supportive?
Mhm.
I think people are being shy.
Hi guys, it's Lindsay. If you can hear me, I'll make a couple of comments.
Yeah, you sound good.
Okay, good, just because I'm driving. I would say having gone through this RB experience during COVID at the start of like a lockdown, I would look forward to, you know, from a family experience having, you know, like what Alyssa said, more in-person things happening for support, like trying to connect, you know, over social media or whatever has been good. But I think just for my daughter to meet other kids who are experiencing the same as her, I think would be, you know, really beneficial. And hopefully those kinds of experiences can happen again sometime soon. And then, you know, we're talking a little bit, Alyssa made the comment about siblings, and I just experienced that 5 minutes ago. I'm on my way home from sick kids after being there the last 2 days, and my older daughter, who's 8, you know, is crying on the phone saying she can't go to sleep because I'm not home. And, you know, those are just like, I know we all experience it as parents, but like those are the things when you have a older sibling who is old enough to know and understand what the, you know, what one of their siblings is going through, it's really difficult. So anyways, those are just my comments and thoughts.
Yeah, thank you so much for sharing that.
Yeah, thank you so much, Lindsay. I'm sorry that having such a difficult time.
She'll be okay. I just told her she cannot, she wanted to stay up till I get home, and it'll be 9:30, and that's way too late for a school night. So she will be home, but it is hard for them sometimes, like you said, Alyssa, you know, being gone away a lot and different things. It is hard on the older sibling too. And like I've had to put the older sibling into counseling because of this, right? It wasn't not necessarily my RB child, although she's in counseling as well. It's the older sibling that needs the support, I'm finding.
Yeah, and these I think are definitely like benefits to having like patients and families as a part of the conversation, because like it's, it's something that I feel may sometimes get overlooked if they're not a part of the conversation, right?
I'd also like to add that at Sick Kids in the past, the oncology program has had a sibling day. It's been running in person in the past, and then during COVID, it did run, I believe they had it at least once virtually to recognize the siblings. Siblings did need to be a certain age in order to potentially participate, but I did reach out to that team previously, that group, because it's a number of social work colleagues that kind of facilitate that. And so there would potentially be opportunities for, RB SIBs to also participate if they're kind of the correct age. So when I hear more about when that's happening again, I'll be sure to make sure that information gets out.
I think if I can make one more comment in what I've experienced over the last year and a bit is I find it interesting because with RB, it's a cancer that's primarily treated kind of almost in day procedures, and then you go home, and so you obviously leave the hospital, which is wonderful. But then I find because it's so much like in an almost like outpatient treatment, you maybe don't in a way get access to some of the resources that you would if your child was in the hospital for longer periods of time. So I think that's one thing that's been, interesting, is just you're going through this journey, but you almost feel very alone because you're just kind of in and out all the time, right? So something else to comment on.
I think that's a good point, Lindsay. I found that, you go in for the appointment, you leave, and they don't kind of find out about all these cool events and things that are happening always. I think the best way is to just share this information with each other, but not to take away from the importance of finding out more support within Sick Kids and within the community, the support that's provided within Retinoblastoma community. We have the Canadian Retinoblastoma Society, who has different kind of events than we do. But one of my favorite things that Canadian or the CRAB or that we do here within the research team is the symposium that happens in January. And where it hasn't been in person over COVID time, we're hoping to get back to that this year. We're planning for a hybrid event where the in-person part, we would like to keep it similar to how it was in the past, where the kids can get together and see each other and meet through play-based, like a playroom where they're all like can hang out and meet each other, and they do medical play, and then opportunities for the adults to sort of learn more and participate in research. And so it's another great opportunity to meet each other. So stay up to date, keep in touch through social media. And if you're in the RB research community, more information will be coming from there as well about the symposium.
I'd just like to congratulate all of you. Oh, I've got a big echo here. Can you hear me?
Yeah, perfectly.
Good. So I think that I deliver the part of delivering the care, but very little impact on the families, let alone the siblings that are at home or coming along and not being really included in all the decisions and everything else. And I just thinking, listening to all of this really excellent cup of tea, that coming together like this, and I'd congratulate Ivana and all the rest of you who put this together, who started this initiative. That must be a very positive experience to be able to have this discussion across all the families. Anyway, congratulations all of you for bringing this forward.
And thank you so much. Yeah, it's been great, like, to hear this type of thing as well. I'm glad Cup of Tea exists. So I think often, like, research should not remain in the weeds. That this is like it leads to very interesting conversations. I see someone, Mary, has a hand raised.
Yeah, so I just wanted to ask or just make a comment. I'm just wondering if you think that the fact that the RB community is smaller than other childhood cancer numbers, whether that has an effect on support, and would virtual opportunities offer more support now that we know it works so well during COVID? I mean, I know it's not an ideal situation, but I think when you have small numbers across Canada every year, and you have the opportunity through virtual means to put families together or put survivors together. Like I've seen so many wonderful things happen on the Zoom network in the last couple of years. I'm just wondering if that's maybe the way we need to go. I mean, I know personal interaction is best, but it's not always available. And, maybe we should take what we've learned from COVID and move it forward to provide support in the future.
Yeah, I feel like, online, like Zoom and platforms like that have definitely opened up a door for the community building. I'm fortunate to have known people like my whole life who were survivors, but it was just contained to my immediate family until 2020 when I came to the symposium at Sick Kids. And prior to that, like RV was a very sore subject for my mom. Like I think I could probably count the number of times she said the word retinoblastoma out in full, like on one hand. And, with a 13-year age difference, I can talk totally openly with my brother now, but it's a little bit different when you're younger and, the age difference is like that. So, I think even seeing how like there's been in the RV community over the past like couple of years, online chats and like Zoom happy hours and things like that for survivors. It's been great to see people from like all over, not only all over Canada, but all over the world get together. And oftentimes it's, you know, in a way that people have it's hard to pull off geographically, like meeting people like that. Yeah, I think it's definitely going to be like a key piece of the community building, like going forward. Even like if, you know, in-person meetups that like it cannot entirely replace the feeling of meeting someone in person, but it's a, you know, a more accessible route often when in-person meetups are hard to pull off.
I guess the thing that brought me to that is that in one of the chat rooms in, I guess it was the One World Symposium, there was a survivor there who I think she was 23 or 24, and she had never met another person with RV ever.
Mm-hmm.
And that just blew my mind. And I thought, my God, how must you feel if you feel like you're the only person in the world that has this? Or
Mm-hmm.
it was the only person that she had ever met. So, was herself until that day. And it was just such an open thing for her to know that there were others there and she could ask questions and whatever. I just thought that was so good. And there's so much of a need for it. So I hope
Yeah.
we continue with virtual. I think it provides a lot for a lot of people.
Yeah, for sure. And I think when people are, looking for like an RV social circle or group or somebody to reach out to, social media is probably the first place to go, or Googling it or something. So, there'll kind of be an inevitable tie to the internet in some respects. Yeah, thank you for your thoughts on that. But Talene, I see you have your hand raised.
We just have we're over our time. If we can keep it super short. Sorry about that.
I'm going to be super quick. I just wanted to say thank you for putting together this presentation. And I think there was a lot of valuable information that I also took from it. I'm the parent of unilateral RB survivor. So, I mean, it's a completely different situation for sure. And I can really sympathize with, those who have heritable RB. But I wanted to say that I do think that like social media has really helped me kind of not only bring awareness, but bring together the RB community. Just recently, I came back on Instagram in February just because I had this quest to raise awareness for retinoblastoma with my book. And a couple of days ago, Metroland Media had interviewed me, and I was on the Toronto Star, and I had Star Trek, an actor from Star Trek. His name is Bruce Horak, and he sent me a message on Instagram saying how like impressed he was and how happy he was that that I'm doing this to raise awareness, because he's an RB survivor himself with a prosthetic eye, and he can't wait to dive into my book. Like, I mean, he's an adult and he's going to read a children's storybook. But my point being that I feel that there is an RB community out there that we don't really even know about, like survivors like Bruce Horak. I didn't even know he had retinoblastoma. So it's sort of bringing that together. And I feel like social media has played a big part of that. So we're able to reach people in other parts of the world too. And really let people who don't know about what people with RB, my son, have been through, really know and become more aware as well. So there is the light at the end of the tunnel, I feel like, I want to say, but I feel like there is like a community out there. We just have to find them. And that's it.
Find them and send them to the RB research community so that we could all stay in touch.
Yes.
Well, thank you guys so much. Thank you for that comment.
Yeah, and thank you for all the work you do on social media, Talene.
Yeah, thank you so much. And Talina, love the book.
Agreed, Talene, you're doing an
so
awesome
much.
job this month.
Thank you so much, everyone. I really appreciate your support too. I can't do it without you guys. So thank you for that.
I look forward to your daily posts this month.
Oh, I'm glad to hear that. Thank you.
Great
If
job,
anybody,
Michelle.
if anybody's
Thank
interested to
you.
continue hanging out, we can meet back in Gathertown. But the
yeah, I
Zoom
can go
link
in there.
needs to be used for another meeting. So thank you for Michelle and Alyssa. This was a really great presentation and great conversations, and everybody who attended, thank you for being here. And have a great evening. I'm going to close out here and